When I think about the Alliance of Minority Physicians, what comes to mind is that old saying where if you want to go quick, go alone, but if you want to go far, go together.
I think at the heart of it is just that sense of family and people who care about you, who will be there, who can understand what you have gone through and what you might have experienced on any given day. That's just really invaluable.
If I were to summarize AMP in one word, I would say that it's a dream.
It's a strong sense of community.
You get a family that's going to celebrate with you.
And a foundation that will really allow us to be our best selves.
The Alliance of Minority Physicians is an organization that I founded approximately 10 years ago with the goal of creating a supportive community, a family, specifically for underrepresented minority residents, fellows, and junior faculty at the University of Pennsylvania Health System and at the Children's Hospital of Philadelphia.
I think one of the nice things about AMP is that it really exemplifies the fact that you don't have to pick between being at a world-class institution and being at a place where you feel like you have family. You can have both.
That's, to me, what the Alliance of Minority Physicians really embodies, bringing people up to where we are, helping support them, helping to support one another so that we can continue to be the best clinicians we can be, the best people that we can be, and the best advocates that we can be for the patients that we serve.
I felt very strongly that it should be resident-driven. They're the ones that had an investment in their own future, and they're the ones that knew what they needed.
I was the first African-American male that we trained in plastic surgery in the history of our institution. And the fact that now 30% of our residency are from an underrepresented medicine group, that is a tremendous accomplishment.
The Visiting Fellowship Program has been incredibly successful. The program involves bringing in talented minority medical students to our residencies, to our training programs, so that they get a chance to showcase themselves. We have community outreach. We have a mentoring families program that is a vertical mentoring model and a horizontal mentoring model. Essentially, the mentoring families include medical students, residents, fellows, and faculty that meet regularly. We have a professional development program where we actually bring in speakers to talk about elevator pitches, how to get promoted, how to publish your paper that you've been working on. We wanted to impart to our members the intangibles that you don't get during your training in your specific programs. How to interview, how to network outside your system, how do you get your finances in order? I mean, these are all things that our residents feel are things that they want to hear about.
Networking is of huge importance to AMP. I think when we talk about building the pipeline in medicine, meaning that you have individuals who go from pre-med and even before that to getting into medical school, to matriculating into strong training programs, and eventually hopefully being faculty in academic medicine, that's a course that's not easy to navigate alone.
Without mentors, without people motivating me and pushing me forward, I wouldn't be where I am today. And sure, I put a lot of work and effort in myself, but I think it's key that because people helped me along the way, I need to do the same.
I've been involved in this because it's honestly a passion of mine to increase representation in the medical and healthcare field. I think when our doctors and our nurses and everyone else in the healthcare field, when they look like the population that we serve, I think we will improve outcomes significantly for everyone and reduce health inequities.
I spent a lot of time in medical school trying to acquire the resources and the manpower to create that community to help me get to where I wanted to go. When I was accepted here at CHOP and within the Penn Medicine system, those types of communities already existed, were already well-funded, and already had many people aligned with that mission. I didn't have to devote so much of my time to creation and more so to support and to the dedication of my own career.
I decided to stay at the Children's Hospital of Philadelphia to become an attending child and adolescent psychiatrist because I saw so many women of color in leadership positions, not only at the Children's Hospital, but also at the University of Pennsylvania.
I knew that I would be able to hit the ground running with lots of operative cases. Additionally, the city of Philadelphia is a predominantly African-American city, and my research passion as an academic surgeon is healthcare disparities. So where better to carry out my research than in the city of Philadelphia. Where better can I be more impactful than a city of need and a city that has a demographic that I want to care for and I want to reach out to.
There's so much that the city has to offer, but at the heart of it, I think it's the people. It is seeing the Juneteenth celebrations, driving through the neighborhoods, seeing communities out. That's what really gives me life, to be grounded in the experience of knowing that there's a really rich community that I am honored to serve and be a part of.
You have all these individuals who are continuing to talk about what it means for us to be an inclusive culture, a diverse culture, a culture where equity is really valued. And I see AMP as a seat at the table so that we can talk about what are the shifts that need to happen in our systems and in the way that we engage with the community.
I think that at the heart of it, it comes back to the patient. And that's actually our motto, is strength through diversity to better the health of the patients we serve.
Penn Medicine is an elite institution. We recently finished in the top 15 in America. I'm incredibly proud to be able to serve an institution that historically has been at the top and strives to continue to stay there.
CHOP is part of top-ranked specialties in the nation. The facilities are beautiful, there's tons of research happening, but honestly, it's the people that make a difference.
Through my network that has been facilitated by the Alliance of Minority Physicians, I was able to land a seat on the International Affairs Committee of the National Medical Association.
I'm working with some of the best and brightest minds.
I was able to match here for residency, and since then, I've stayed as a chief resident and now as faculty. I've been lucky enough to work with some amazing leaders to ensure that we foster an environment that is inclusive and that we continue to increase our diversity.
I trained not only at CHOP, but I also trained at Penn. And the mentors that I had met along the way were really instrumental in me developing into the clinician that I was hopeful to become.
This is really a phenomenal place. I think not only do you have world-class educators, you have people who are leaders in their field. And if you are an applicant who cares about diversity and inclusion, who wants a place where people make intentional communities to support the diversity of our healthcare workforce, I think this is the place for you.